be discussing several topics on skin health. As a doctor, you would have seen a lot of people come with acne. Do you think it takes like a toll?
If your acne is not responding, if they are very painful, and if they're oozing pus, you're having pain with acne and you're having huge, like big acne on your face.
Did you know that skin conditions like acne and eczema can worsen from stress? Today, to discuss skin health and get more such interesting information, we have with us Dr. Arti Priya, who has over 8 years of experience. Hi, doctor.
Hi.
Thank you for joining us today. Today, we're going to be discussing several topics on skin health and skin conditions, and we would like to hear your insights on the same.
Sure, I'm excited as well.
Okay, so starting off with acne. Acne is something that all of us face, most of us face. So we would just like to know, like, why does it happen?
To put it simple, acne is basically happening because of your hair follicle getting clogged up, also because of increase in sebum production. So both of these together clog up your oil glands, and that's what you visibly see as acne.
And is there like a specific age group that is more like that this happens more to, or all age groups?
So when you look into acne, it is pretty more common in an adolescent or a teenager, either because of the hormonal fluctuations they go through. But nowadays, acne you can get in any age, even in adults, like people who enter into like 30s, 40s, they tend to get acne. That is probably because of the lifestyle changes, the stress part, the food you eat, and so many things contribute to it. So yes, acne is being prevalent in almost any age now.
Okay, so you mentioned lifestyle. What aspects of life in today's lifestyle do you think is contributing to this?
So the major contribution in your lifestyle is the diet. So processed food, dairy food, high glycemic index food, they contribute a lot in getting acne. And the second thing I would say is stress. So with the ongoing work schedule, and even adolescents, kids, they have a lot of stress that is going through, that increases cortisol in your body and again contribute to inflammation that can cause acne. And another thing that I would say with respect to lifestyle is lack of sleep. So people think they sleep 8-9 hours, but it's not actually the time, it's the duration. So if you don't sleep at 10 o'clock, post that you sleep, your body automatically starts secreting the stress hormone, that is cortisol, that is going to again perceive your body and make it think it's in a stress.
Okay, now that we're talking about stress and like mental health, as a doctor, you would have seen a lot of people come with acne. Do you think it takes like a toll on one's mental health and personality?
Yes, definitely. Off lately, especially ever since this era of social media and so many things have improved. Right from school-going kids, they find themselves more conscious when they have acne, when they are with their peer groups. It affects their self-esteem. They are not like going out on social gatherings if they have acne. And yes, other than that, in cases when your acne is very severe, it causes a lot of pain, pus oozing, and so many things, like, they actually have a very factor in impacting on them psychologically that makes them take treatment for it.
Okay, so a lot of people use makeup to, combat with the acne that they're having, to go out, to be with other people. Is that good for your skin, bad for your skin?
Occasionally it's okay to camouflage your marks and scars, but one thing, acne scars, which causes a lot of textural changes, cannot be camouflaged with makeup. But yes, you can camouflage your acne, but make sure you double cleanse it and remove the product. And also when you're choosing your concealers or foundation, make sure they are like very light gel based. Don't go for oil based or cake based makeup, which is again going to clog on your pores. And you should definitely double cleanse to remove your makeup, especially using to camouflage your acne.
Okay. Now moving on to like therapies. We've all heard of like home remedies, stuff that like our parents, grandparents have told us to help with acne. So what do you think? Are those good, or should we just go to a doctor?
Again, it depends upon the cause of acne. Okay, there are so many things that influences why you get an acne. So I personally somehow feel only if you treat the cause, you can get rid of acne. So even let it be a prescription-based medicine, using that alone and leaving the cause of acne, it's not definitely going to solve it. So each acne as a cause. So if you go towards treating the cause, then anything works. But if you leave that and you just concentrate on treating the acne, I personally have not seen any great improvement with it.
Okay, so I've heard some funny stuff like people put toothpaste on their zits or pimples to help fix it. What's the craziest thing that you have heard people do?
Yeah, toothpaste, lemon, garlic, ginger garlic paste.
Okay.
Whatever you put in cooking, they put on their face and they end up with burns. And I've seen people who are having very serious burns because of that. So more than the acne, the burns and the marks of that is going to stay on the skin for a longer time.
It's going to do more harm than good.
Correct, yeah.
Yeah. Okay, now moving on to another topic, which is of social media. So a lot of skincare talk on social media nowadays. And there are a lot of pundits, influencer pundits, online pundits telling us what to do for skincare without any real medical backing. So what are your thoughts on that?
I really don't know how to comment on this. I would rather put it like this. I see people who are listening to them are getting way more aware, because there are a lot of doctors who are coming up and giving genuine content. So I think the audience are getting more cautious. I used to go read on the comments like what people comment on it, but most of the time they are well educated to comment like no, all of these doesn't work, you go see a doctor or whatever. But yes, before you use anything on your face, know your ingredient, what is there in that, and put it on your face, because people are well educated with so many influencers who are doctors are giving in good input. So in that case, I feel it's okay. People are able to make out which works and which doesn't work. Exceptional cases are there, but still.
Okay. Now you mentioned diet. Diet is a factor in why acne has increased even in older people now. So, for example, someone like loves eating like chole bhature, pani puri, something like that. What can they do to like help with their skin?
So I wouldn't actually advise anyone to avoid anything, because that's definitely not going to help you in long run. I would rather say like have portion control. Like you like chole bhature, okay, eat it. Like eat like half of it. You should know to control your portions. Only when you know to control your portions and know to control, avoid binge eating. This is more or less like your lifestyle modification. Okay, acne treatment is not like 1 month, 2 months, never. It's about how you manage the various triggers that is going to happen in your life and get along. But many times you have craving, you eat it, it's okay. 1 or 2 acne is going to come and you can treat it. At the end of the day, it's like how you take it and go, right?
Yeah. Okay, so there's a lot of some people have a lot of confusion. Are acne and pimples the same thing, or is there a difference between the two?
It's actually the same. Colloquially, we call it as pimple. Medically, we call it as acne. So both are same.
Okay. At what point would you say should someone consult a doctor in terms of their acne?
Okay. So when you are having breakouts, especially on your jawline or especially on your like forehead, lot of breakouts, and when your acne is not working with all the conventional therapies that you've tried, or now people even go a little more, more when treating their acne. They get antibiotic gels and use seeing influencers and everything. If your acne is not responding, if they are very painful, and if they're oozing pus, you're having pain with acne and you're having huge, like big acne on your face, and if it is affecting your self-esteem, and if it's something which is affecting you psychologically, then it means that it's no longer going to work with any of those home remedies or the creams that you're going to try. It's a good chance, it's a good thing that you go and get yourself checked with your dermatologist.
Okay, so once you go to a dermatologist, what are like the therapies that a dermatologist would offer? What would the therapies you would offer?
When it comes to treating acne, there are wide range of options available. So the choice of oil, the treatment mainly depends upon the type of acne you have. So there are different types of acne, right from comedones to the nodulocystic acne, which are huge acne filled with pus. There's a wide range of treatment that is available, which can be customized according to the patient who's coming, the age of the patient, the kind of acne, and what kind of results they have. Right from using topical creams, which has clindamycin, metronidazole, adding of an oral antibiotic, or adding on isotretinoin, plus adding on procedures like chemical peels or other therapy. The treatment options is a wide spectrum, which will be personalized and customized according to the type of acne they have.
Okay, so there's a new trend of Korean skincare entering the Indian market and on social media as well. So there's a certain thing called light therapy, red light therapy. Do you think this is effective in treating acne?
Yes, LED therapy is very effective in terms of treating acne. So there are two different lights that comes from an LED mask. One is the blue light, another one is the red light. So what this blue light basically does, it helps in targeting the bacterial count in your oil gland. So acne can also occur because of bacterial colonization. Something called as P acne happens. So they basically target the P acne inside your oil gland and they destroy them. Also, it helps in reducing the inflammation. So whereas the red light also helps in healing and inflammation, it's more for a person who's undergone any procedure, rejuvenating procedures, for anti-aging. It helps in, to a certain extent, it helps in stimulating your collagen, it helps in healing and again reducing the inflammation.
Yeah. Okay. Red light therapy, light mask, light wands, all of these. Do you think if someone just uses them alone, that will fix everything?
I wouldn't actually vouch for it. So it works very well as a combination therapy with when you're using creams and your medications and everything. It goes along. It works as combined with your other modalities of treatment. Again, if your acne is very mild and simple, or you're using it for prophylaxis of increase in acne, it works as a monotherapy. Else, it works best when it gets along with other modalities of treatment.
So it's like a holistic thing that one needs to do. Okay, so moving on to the next topic, that is dermatitis. So what exactly is it and why does it happen?
Dermatitis is nothing but an inflammation of the skin. So if the skin barrier gets disrupted because of so many factors, it becomes inflamed, it becomes red, oozy, itchy. So that is what we call as dermatitis.
Okay, and is there an age group in which it's most prevalent?
Yeah, dermatitis as such can affect anyone because skin is the largest organ in your body.
Yeah.
So there are various triggers that it could get irritated, inflamed. So it can affect any age group, but more prevalent in kids.
Okay.
Whose skin is very thin and sensitive, and in old age people, again for the same reason.
So are there like internal and external causes for it?
Yeah, so dermatitis can occur because of a wide range of causes. When you put it as internal and external, so external triggers could be the environmental factors, the climate, the humidity of the place where you are, the water quality, and also something that you can come in contact with, which is a potential irritant to your skin.
Okay.
And internally, few people by genetic, they have very sensitive skin. The skin doesn't produce enough oil to keep it moisturized.
Okay.
And also, if you are prone for allergies, like if you have asthma and other allergic symptoms in your body, you tend to be more common, easily get dermatitis.
Okay, and is it a contagious?
Dermatitis as such, it's not contagious because it's just an inflammation in your skin, but many times it can get super infected with either a bacterial or a fungal infection. In that time it can be contagious, but usually dermatitis is a non-contagious thing.
Okay, so we spoke about external factors, internal factors. Lifestyle, does it have a role to play in this?
Yes, definitely. Again, this comes with age group.
Okay.
So dermatitis, which is more common in an adult, can be because of the lifestyle. It could be because of the things that they're coming in contact with. Like if you're a person who handles a lot of chemicals, or your occupation is seeking you to wash your hands frequently, and again with respect to the water and everything, you are prone for getting dermatitis on your hands and other exposed areas.
Have you seen people be like mentally affected by this because it takes over your skin?
Yeah, definitely dermatitis that is occurring because of atopy, which is an allergic tendency. They just don't leave you permanently. There will be seasons of exacerbation and remissions. Many times dermatitis can cause permanent marks, pigmentation in your body, like sensitive areas like under your eyes, corners of your lips, hands and everything. To a certain extent, I've seen it affecting the self-esteem and psychology of people who are having extreme or severe dermatitis.
Okay, so what therapies are there for these people?
Again, dermatitis comes as a holistic approach. So, right from the triggers to prevention, you need to do when you are prone for getting dermatitis. So, you need to moisturize your skin. That's very important. So, moisturizer forms like the definitive thing for a person with dermatitis. You need to keep more caution when you're choosing products like your hand washes, face washes, soap. And with respect to the inflammation, depending upon like how much it is inflamed, you can start with topical creams. Like your dermatologist will be starting you on topical creams and ointments. It can go for addition of antihistamine tablets, antibiotics, depending upon what all comes along with it.
Okay, so is the effect different for different skin types?
Yes, definitely. So, dermatitis affects the most for a person with a sensitive skin. It's very severe for them, and it almost comes up with phases of remission, exacerbation. But for a person who's like, as I told you, they come get it with any sort of external contact. Once that chemical or the contact happening is stopped, they tend to recover much faster.
Okay, and is light therapy beneficial in treating dermatitis?
Light therapy for dermatitis, again, if you are having atopic dermatitis, like the sensitive skin on the face, the red light, as I mentioned, could help you in healing and bringing down the inflammation. Also, to a certain extent, it can help you with collagen remodulation. But again, it doesn't go along, it doesn't go by itself.
Everything
probably
together.
Yeah, as a maintenance and all.
Okay, so is there like stuff that people can do at home remedies for this?
For dermatitis, I would strictly suggest please don't try anything, because already the skin is inflamed. There's a lot of inflammation. Anything that you do with respect to home remedies, even application of simple aloe vera and turmeric can complicate dermatitis, because they are like sensitizers. They work on intact skin, but they don't work on an inflamed skin. So what you can do by max is by applying some bland moisturizer. If it is not going, please get it checked with the dermatologist.
Thank you so much for joining us today and having this insightful conversation with me. We loved having you here.
Thank you so much.